Doctor, when should I go for IVF treatment? This is a question I'm often asked. So usually I tell my patients that if you're planning a pregnancy for more than 1 year and your age is less than 35, you must visit a doctor. I'm not saying that you have to directly go for IVF, but that is the time when you have to visit a fertility doctor. Or if your age is more than 35 and you're planning continuously for about 6 months, this is the time where you need to visit a fertility specialist. Now, again, when to do IVF? That is the question. So in that situation, usually we ask the patient for a thorough evaluation, and if everything seems to be more or less normal, if there is some kind of a mild male factor in fertility, or if the patient's age is not very advanced, like if your age is somewhere more than 30 but less than 35, in such situations we tell the patient to try naturally for 2 or 3 months, but along with that we do ovulation induction and follicular scans, where we see which day is the patient ovulating, how is the endometrial thickness, whether she's ovulating on time or not, and we ask the patient to have sexual intercourse during the ovulation days. If that also doesn't work out, then we suggest the patient a little more advanced treatment like IUI, that is the intrauterine insemination. In that, what we do is that we do a follicle study, give the patient some medicines for the egg growth, and when the ovulation is documented, we take the husband's sperm, do the sperm washing, and we choose the most motile and good quality sperms and inject it inside the uterus of the patient. This is like a daycare procedure, like you just come in the morning and within 1 or 2 hours you can go home, and it does not require any anesthesia. If we have seen that the patient has undergone more than 3 to 6 cycles of IUI and still there is no pregnancy, in those patients we suggest them to think about IVF. Also, there are certain patients in which there is no other option than IVF, like a patient whose husband's sperm count is very low, or if the husband has got azoospermia, if the patients have got blocked fallopian tubes, they have tried a laparoscopy to open the tubes and still they have not been successful, or a patient who has got very low AMH and it's a very advanced age, then in those patients also we suggest to go for IVF. For more information, you can call us and we can give you a consultation to try to understand what is your main reason of infertility and guide you further so that you can achieve the dream of parenthood as soon as possible.